Thank you very much, Sarah. You can go with the next slide. And we can go with the next slide, please. Okay, one of the things I want to point out is I got to tell you, my hands are sweating a little bit because I'm very excited. Everybody's heard my lecture before, but we're going to be Eddie. His nickname is Eddie, but he's Eduardo. He's a podiatrist from South America, and I'm going to talk about the Remy laser. You both know it's a therapy laser, and it's also a surgical laser. But we're going to really focus on onychomycosis tonight because Eddie's lecture is going to really open up another world or another option in your toolbox of treating a very difficult condition called onychomycosis. He's also going to be talking about verruca and skin fungus also with photodynamic therapy. And I'm very excited about this. I'm very excited. So as everybody knows, my mission statement is you have to have an effective outcome. The laser has to be effective. It must be affordable. And all this meets the Remy laser itself, and also photodynamic therapy itself. And that's really cool about this. Most of the treatments that I bring with the Remy and with my company, Zuckerman Future Technology, are effective, affordable to your patient. But effectiveness is the top thing you want to look at. Again, a fast return on your investment. You will always get my advice and expertise. If I don't have it, one of my goals in life has been you don't have to be the expert in anything, but you have to know the experts. And you're going to hear an expert tonight in photodynamic therapy. So my job is not only to try to make the best lasers out there, but also bring the best treatment protocols. Along with that is marketing. And that's why we have Sarah Bridmeyer, who is everybody knows Sarah and her expertise in marketing. We also will bring in many, especially Chris Milkey, who is one of the icons in practice management. All the people that I bring on, next slide, all the people that I bring on are people that are actually practicing. They're not reading books. They're not telling you something that they haven't done themselves. Again, with the Remy, it is FDA cleared for pain, inflammation, and surgery. It's also ablative and non-ablative warts with a local or without a local. But tonight we're going to focus on fungus toenails. Wounds is another thing. But tonight I'm really going to focus a little bit on therapy, but we're going to get into fungus toenails because that's where Eddie comes in. And you're going to really love this lecture he puts on. I was privileged to hear this a few weeks ago. We're all learning. That's what it's about. An expert is somebody that constantly is learning to improve his treatment, which is very important because the better you have treatment options, next slide, the better your patients will appreciate you and refer you. Again, the Remy, it can go anywhere from 0.1 watts up to 30 watts. It's actually a class 2, class 3, class 4. It has a multitude of power ranges. Next slide, Pierre, please. Again, the Remy is therapeutic, and it's also, which means it works on a photochemical reaction, and it's also surgical. So it's two. You ever heard that 2 minutes in one? It's 2 lasers in one. Very unique laser. Next slide. This was a study that was done. It shows the effectiveness of therapy, class 4 lasers in therapy. It's over 30 years old, therapy lasers, just so you know. Next slide. So how do therapy lasers work? Very briefly, they stimulate dysfunctional tissue through a photochemical reaction, which creates an ATP production, and that's what starts the repair and improved function of your cells. You need ATPs. Next slide. That's very important. If you ever want to really delve in this, I can give you a 250 slide deck just on that topic alone. My goal is just to get you the foundation and the basics. Again, you have light energy. It stimulates the chromophores on the mitochondria. If you all remember, mitochondria produces ATPs, and that's where the cascade of biological effects, which is wound healing, pain, repair. Next slide. Wounds, a lot of people don't use lasers for wounds, but that's how they all started. Think about wounds and think about lasers. You can also think about it with fungus toenails. Not only do you want to kill the bacteria and the fungus, you also want to repair the tissue. I look at a fungus toenail as a devitalized, sometimes an avascular. It's like a wound that you need to repair. That's an important thing to think about. Look at your fungus toenails as devitalized tissue with bacteria and fungus. Next slide. This is just a short slide showing how well lasers do to repair wounds. This was a slide where on the left it had multitudes of other treatments for wound, and this was 2 treatments. You can see the difference. Again, if you want to really see a study, there was a study done at OCPM, which is Kent State today, where they use same protocols I use on the Remy for wounds for diabetic, venous, arterial wounds. The wound healing was phenomenal. Next slide. We can move on with this one. I'm going to be skipping around because I really want you to hear Eddie's lecture. You can laser therapy. It's all about dosage. Just like you have an antibiotic, you need the correct dosage to eradicate the infection. You need the same thing with lasers. Next slide. You need proper, what's called, we can slip this one right here. I'm going to be going through these slides. Power density. Power density, just like an antibiotic, you need the right dosage. You need the right amount of energy in an area to get the, what we call the photobiomodulation effect, or the photochemical reaction at the mitochondria. You need the right dosage. That's the key. Next slide. The Remy has 2 wavelengths, the 980, which is it's very good for the analgesic effect. The 810 is among the best wavelength for depth of penetration and also photobiomodulation, or to start that photochemical reaction. Next slide. This was a slide. I actually hired somebody I'm always trying to improve fungus toenails or onychomycosis. It's another reason why Eddie is on tonight. Fungus is a very difficult condition. This was a study that we did to show the effectiveness of the 810. The 810, when you combine the 810 and the 980, you're getting some pretty good results. But we want to get better results and improve it, because fungus is a very difficult condition to treat. There's not one treatment fits everything. And that includes even with oral. Next slide. We can skip this slide. How much is enough? You need approximately 6 joules of energy at the target to get that chemical or photochemical reaction. That's why you need a high-powered a laser like the Remy, because you want to really get a lot of energy there, because energy is deflected, reflected. It's not like a straight beam. It's vacillating. That's with all laser wavelengths. Next slide. Other factors which is important is that I like continuous. The Remy can do pulsing and it can do continuous. We want to get the Remy for onychomycosis is high powered. We are pulsing, but we're firing 25 watts of energy every 3 milliseconds. Most of the lasers out there are not that, cannot do that power. Again, you need the energy to get into the cells to create that photochemical reaction. Next slide. So why do lasers fail for therapy? Under penetration, just like an antibiotic. You can have the right antibiotic, but not the wrong route of administration, or you can not have enough energy. Again, dosage. If the one thing you can learn from me, learn about power, density, and dosage. That's so important. Next slide. The keys to better outcome are higher power, and that's very important. That's why I'm always trying to improve. The Remy, you could read an article in the Remy, and it could be almost any protocol when we're talking about wattage, frequency, and duty cycle. They may not mean anything to you, these terms, but you can adapt. The Remy can be adapted on all 3 parameters. Next slide. Again, you need more power. More power, they call it the peak power. You get better penetration, but you need a certain amount of energy to turn on that photochemical reaction. Next slide. Relief. With the Remy, I'll teach you, I call it the wow experience, because I'm going to show, the only way you know you're getting the right power density when you're talking about musculoskeletal or arthritic conditions is by palpation. For example, the plantar medial insertion of the plantar fascia, you palpate it. When the pain is gone, you got the right dosage. With training by myself, I train everybody individually. And that's a very key point. How do you know that you got the right dosage? It's all about palpation. Next slide. And that's important to get pain-free the first visit. Physical therapy. It's not an end-all, but a lot of conditions, it's more economical and sometimes more effective to do laser therapy in the office. It's amazing post-surgical for range of motion, reducing scar tissue. If you reduce excessive inflammation, you're going to reduce scar tissue. Next slide. So you want to get a laser that's affordable, that has the highest energy. The typical class 4 30-watt laser dual wavelength is at least $30,000 on the market. I've eliminated the middleman. To be honest with you, I want you to have the best laser, and I feel the Remy is, if not it's the best, it's one of the best, but it's affordable. We go back to my mission statement. It's got to be affordable to the patient, affordable to the practice. Next slide. With a lot of support. Lasers and microdrilling. Next slide. Onychomycosis. The Remy is FDA cleared for onychomycosis. Next slide. We're going to talk about microdrilling, and Eddie is going to talk about a little bit more when he gets into photodynamic therapy. I like the idea of using what we call microdrilling. This is a bit that I've helped develop with Janelle. That little white sleeve, I don't know if you guys can see this, the little white sleeve is a guard, so you can only go 1 millimeter, and that's all you need. When you drill into the nail, next slide. When you drill into the nail, you don't have to debride it. You drill into the nail, you put these little holes, it dries the nail out and allows whether you're talking about photodynamic therapy or talking about a topical, it gets inside the nail, and that's key. That's been the big weakness of topicals. It doesn't get into the nail. Another thing, and then you also use the laser. The laser itself helps to oxidize fungus and repair. So we're talking now, we're going to add the photodynamic therapy, where not only do you put the little holes in the nail to get better penetration, whether it's the methylene blue or the topical, you also are changing the environment, and you're using the Remy to not only stimulate the oxidation, and Eddie will go into much greater detail with this. This is a slide that's interesting. I call it the fire break. In California, one way to stop fires is to burn a section out so it can't move forward. This could be post-treatment, or we do this during the treatment. You see these little holes. We've separated the fungus disease nail from the fairly normal, so that you, one of the things I found out is as you're treating a fungus nail, it can get reinfected. Even though you're doing everything right with with post care, laser care, you can also use these little holes after you've cleared it up to constantly prevent fungus from getting reinfecting. But this has been a real big breakthrough with the fire break. It doesn't allow fungus to advance. It's a firewall or fire break. Next slide. Again, we're talking about when you put the little holes in, it airs it out. I personally like alcohol-based topicals because alcohol is an antiseptic and it's a drying agent, and it's very good for penetrating. Next slide. These are the little burrs I'm talking about, the matrix burr. I used to sell $10,000, $15,000 micro drills, the clear nail, the path former, and I learned a few things. One is they all only go 1 millimeter. This matrix burr is actually the bit is actually bigger than either clear nail or the path former. But the beauty of it is it has that little white sleeve you can see in there, and it can't go any further. It's been out. I didn't invent this. It came from a company called Lacuna in England. They've been doing it for years. What I did was I made the shaft so it can fit any drill you have out there that they're using for burring down nails. And you don't have to burr down nails anymore with these at all. Next slide. So the use of the Remy with the microdrill is just one treatment. Again, we're going to have Eddie talk about another. It's either going to be stand separately, it can be in combination. It's your clinical judgment. Next slide. So with the laser, the Remy laser and microdrilling, it's a dual approach. You're getting topicals to go deeper. You even get the laser to go deeper because you've got holes in the nail. Our whole goal is to improve. My personal opinion with fungus toenails, it's anywhere from 50 to 80% successful. It depends on the factors that, for example, the biomechanics, the genetic, the deformities. There's a lot of factors involved with it, but we're always working towards that number. I still have doctors saying to me, I get 90% success rate. That's pretty hard to believe. You know, it's very hard to believe because every set of patients can be different. I want you to be able to evaluate that patient and what's best for the patient, whether it's Remy, photodynamic therapy, Remy and photodynamic therapy. You can use all three. You know, it all depends on the condition. Eddie and myself are always available to help you with those decisions. Next slide. Again, you know, the Remy, it's very unique. It's only 4 pounds. It's a dual wavelength. Here it says 4 wavelengths, but I do have a 4-wave dual. I have found that the dual, as opposed to the 4-wave, the dual is better because each wavelength is 15 watts. The Remy has, next slide, it's the only laser I know. It's this is an old way it was set up. We've advanced to another model, which is this. Next slide. You now can go from fungus to therapy to surgery without touching the fiber optic cord in 5 seconds. I always design and improve lasers and protocols as I'm the doctor in the room. Next slide. They have screens. You can use my protocols. They're all FDA cleared. We also can adjust for body size, for skin color, chronicity. These screens are in there also. I teach you both ways. Next slide. Again, the most important thing, and this has been my biggest advancement, is that I get to call the shots now. Anytime you speak with a salesperson, you're paying at least 30 to 40%. I've taken that and given it to you from one podiatrist to another. Next slide. You need marketing. Fortunately, we have Sarah Brynmeyer of 10 Toes Marketing. She knows podiatry. You should go on the website and take a look at some of the marketing that's there. We've got landing pages for your website, videos. You've got postcards, brochures, all customized. I like customization. I also have a little bonus tonight that anybody that purchases the Remy within the next 24 to 48 hours, I will do a customized video. Well, actually, Sarah will do it. Where you're going to be in the video. It's going to be you. I think that you're the brand. It should be on and you talking about it and not somebody else talking about it. So go on the website, take a look at it. Next slide. Again, this shows you the size of the Remy. It was named after my Yorkshire Terrier, Remy. It's small, smart, stubborn. It works well. If you ever, if there's the website, there's my number. Reach out to me, ask questions. I think you'll be very impressed with the Remy. The Remy is it's got a 5-year warranty. Very little problems with the repair on it. I can still count on my fingers the repair. With this technology we have today, everything can be fixed almost on the phone or through a software adjustment. But very, very few problems repair-wise with the Remy. And it's been out for over 2.5 years. Next slide. And the next slide is going to be our star guest speaker. I call him Eddie. He's going to tell you a little bit about him. He is a colleague, a podiatrist, and I feel privileged to have met him. He's going to talk about photodynamic therapy and give you experience. Eddie, I appreciate you coming on tonight from Colombia, South America.
Hello, thank you very much. I appreciate the invitation, David. Thank you for having me, and thank you everyone for being here. So we are just about to start. I'm not sure if everybody's been.
We can see your screen. Everything looks perfect.
Okay, so a little bit of for whoever might speak a little bit of Spanish. So bienvenido, welcome, and let's talk a little bit about what this is. Okay, and this is what I call actually a
I'm not seeing your.
PDT, or
I'm not seeing the slideshow.
can you see it? You don't?
Yeah, I can see it. I'm able to.
I wonder why I can't.
I'm
Right.
not sure, but as far as I can tell, everything on most of our end is doing good.
How do we know that everybody can see it?
Oh, let's see. Maybe I can. Could somebody in the question in the question field just okay, so we've got a couple people saying I can see it, so I think we're good. David, I'm sorry you can't.
I can.
I'm not
Okay.
sure why,
Don't worry
but it
about
looks like our audience is able to.
All right, very good. So very briefly, as David said, I am a podiatrist. I actually finished my studies in Mexico, and then I went for PDT. I became a PDT facilitator in the BIOS Training Center in Brazil. Therefore, I have experience, or I've been experienced, and grateful to be experienced in Brazil. I've talked about photodynamic therapy for the past 7 years now, traveling all the way from Mexico, Brazil, Ecuador, and then I had the opportunity to go to Spain, Barcelona, and Italy in Milan, and then came back to Colombia as well. Besides that, I am a assistant nursing from the San Pedro Claver in Colombia, which is a local university or a national university. And I am a podiatry associate's graduate from the Autonomous University in the state of Nuevo León in Mexico. So it is called 101 because this is pretty much the basis of PDT. And so before I begin, just let's remember to wrap up what David was saying. Phototherapy is specifically the use of a particular wavelength of light. It has been shown to be effective in several various treatments. In this case, we're going to be talking about focusing on onychomycosis. It's a therapeutic alternative, and it allows cells destruction, which is pretty much the basic or the main focus on what we do. So as an introduction, in speaking of the state of the art of the photodynamic therapy for localized infections, it involves the systemic or topical administration of a photosensitizer in combination with methylene blue, and then the number 5 aminolevulinic acid or ALA, and the MAL, which is the aminolevulinate, which are a precursor of the endogenous photosensitizer, which is called the photophosphorin 9, and a subsequent selective illumination of the skin lesion with light of the appropriate wavelength. So wait, what? Say what? This is like way too complicated. And as I said, we're gonna do this like the easy way. So do it again, okay? What is photodynamic therapy in the state of the art? Very simple. This is a treatment that will involve the application of a light sensitive medicine. Let's call it a photosensitizer. In this case, the methylene blue. Then we're going to need a light source, which is in this case Remy, or and as we spoke of the laser prototype or type of the one that we have, the Remy. The idea or our main focus will be to destroy abnormal cells of a target lesion in order to promote localized oxidative photo damage, and then of course what is called the apoptosis or cell death. This is going to allow small abnormal areas of tissue to be treated without the need of surgery. So the main focus, if you heard at the beginning of everything that David explained, is that we are going to be able to help or to aid without the need of surgery. And in this case, also without the need of medicine. And we're going to get there in a moment. Just to remember, the main differences between red, infrared, and white visible light. Let's remember, any type of light will affect the skin. Okay, it depends on the type of light that we're going to be using and the application and the purpose of it. Then it's going to have a different action. For example, or then in other words, you might remember going to the dentist, and then in a certain point when he does apply this paste that he's using on a tooth, he's going to be applying usually a blue light. So for those of you that really are reluctant to believe in this still, let me just remind you, we have what is called the visible spectrum, and depending on the spectrum, or each spectrum will present a different length and penetration. So do you believe in treatment with PDT or light? Yes, you should, because getting back to the history of this, let's remember, back in the ancient Egypt, they used to treat vitiligo with this exposure to the rays of the sun. So you can see that. Okay, you can go to the dentist, as I said, and have your tooth fixed. So if you can do that, you have also believe, or you have to believe in X-rays. Then you can believe also in gamma rays. So let's hope the Hulk doesn't show up. But I mean, being serious, within the specific spectrum, then we're going to be able to have a particular treatment. All right, just for you to know. Any wavelength spectrum is going to be measured in nanometers, where a nanometer is 1/billionth of a meter. So we call this the state of the art because originally was developed as a treatment for cancer. It had an ophthalmologic ophthalmologic disorders and in dermatology. However, now it is being of interest within the antimicrobial effects of the photodynamic therapy, and it has been proposed as a therapy for a large variety of localized infections, in this case, fungus. All right, so in many instances, there has been an attempt to perform a little bit or get closer to the effect of the PDT without the PDT, and then it's being used in lab practices, the biological tissues of materials to mimic the use of PDT. Okay, what's the purpose? What we know, or what we are focusing on, is to kill microbial cells in infections. So what's wrong then? Okay, within the pharmacology, and everyone at this point has ever either recommended or actually gone to the doctor, and the doctor told you once that you can use either clotrimazole, itraconazole, terbinafine, miconazole, ketoconazole. Those are the azole family, and we found, or within studies, we all know that they have side effects, and there are some of them here: peeling, redness, stinging, swelling, skin irritation, etc., etc., etc. So the difference is that the common problems that an antibiotic presents, many of them, or the three most important ones, are: it has an inappropriate prescription in many cases. Sometimes you have maybe a family member that tells you, hey, use this because I bought it at Walgreens, or somebody gave it to me, or my doctor gave it to me, and remember, what it's good for me is not good for the next person. So it's sometimes, in many instances, it's not going to be used for you past 1 year, or maybe past two months. All right, so that brings the failure to complete treatment regime, then the widespread use in livestock feedstock. So the resistance level increases, and that's going to have actually a very few good moments of an antibiotic, and that's a common problem. Okay, the advantages of the PDT then is going to be that it covers not just the bacteria field that the antibiotics cover, but it goes all the way from fungi through virus, passing by through parasites as well, and bacteria. So it is practical. Why? Because it is safe for human tissue. It isn't expensive, really. You know, once you have it, once you have the Remy or the equipment with you, it is pretty much providing for you instant results. It doesn't require patient compliance. It's very versatile. And the systemic antibiotics cannot get into death or damaged tissue. Okay, even if antibiotics work, they take several days to actually show its effectiveness. Okay, when you apply PDT or the effect of light, then it has going to have like a broad therapeutic window. It eradicates pathogens and biofilms, eliminates development of resistance, and destroys secreted virulence factors. Right? Very simple. So the visible light, when it comes to the photodynamic therapy, uses, as I said, a photosensibilizer and the visible light of the appropriate wavelength to generate cytotoxic reactive species in the presence of oxygen. In other words, PS plus a light source plus a molecular oxygen is actually what we call PDT or photodynamic therapy. All right, so speaking of this wavelength, let's remember absorption and penetration for red and infrared radiation will present reflection, absorption, dispersion, and penetration when we're speaking of micromolecular activity, all right? So factors such as position and angle, skin pigmentation, surface type are also factors that are going to be determining factors for you to be successful when applying light in combination with PDT. So there are actually, and this is like a very brief introduction, 4 particular laws that are going to be applied which govern the behavior of electromagnetic waves. So really quick, the first one is called the distances inverse square law, which establishes very simple the intensity of electromagnetic radiation that falls on any given surface is inversely related to the square of the distance between the emitted focus and the surface. In other words, once the distance is being doubled or it increases, the intensity per frame will lower. Therefore, energy will eventually get lost. Very simple. Number 2, the Lambert's-Cousin law establishes that the maximum intensity of irradiation on a surface is obtained when the beam of light falls perpendicularly on it. All right. However, when we talk about laser, then we're going to talk eventually, or in a few moments, of the difference between laser and LED. This will be a very strategic way of using or applying the laser power. All right. Remember, the Remy is very powerful. Now let's go to the third one, the Bunsen-Roscoe law. This is very simple. It refers to the intensity versus the time that is going to be applied on any given surface, which means that to obtain effects, and this for this intensity is inversely related to the time of application. In other words, if the intensity is super high, then you're going to have to measure the time that you're going to be applying it into that particular surface. If it is more intensity, less time. If it is less intensity, more time. That's the simplicity of it. All right. Then finally, the Grothus-Draper law. This is very simple, and to have a specific calculation of the dosage, you have to have an estimate energy times the versus the one that is going to be absorbed to avoid reflection and achieve dispersion. And remember the 4 points that we talked about previously, how it's actually distributed within the molecular activity that is going to have a good performance. So really quick, just to remember the differences of what it is there in the market that you probably saw, that you probably heard of. And if you didn't, then I'll tell you a little bit about it. We work, or I have worked with these 2 different types of equipment. The laser, which is the acronym for the light amplification by stimulated emission. The 3 main components is that it has a defined frequency. It's very coherent, or it's called collimation, which is the actual path that it's going to follow, and it spreads like a beam of light. Okay, when we talk of the LED, the light emitting diode, it has an indefinite frequency. Is not it has 0 coherence. It's incoherent. Has no collimation. It disperses within the space as one of those party lights. And because of that, it might cover a longer area of action and dispersion. And depending how you want to use it, are the results that you're going to obtain. All right. So when we talk of PDT, then I personally have used always the methylene blue, and the chemical composite there is known also as methylthenionium chloride, which is very inexpensive. You can find it very easy. It's very available. It's a medication, and it actually works to dye. If you remember, or if any of you remember, getting back to the biology classes, we have the positive and the negative gram cells. So the positive ones were the ones that were supposed to be discovered by the use of a dye or a particular color. And so that's pretty much what we do when we use the methylene blue. We actually pigmenting or put a pigmentation on that particular cell that we want to focus on in order for us to give a particular beam of light. In this case, the laser light, and with the frequency, the correct frequency, we're going to cause what is called an apoptotic cell. And I'll get to that in a minute. So once again, here's what I told you earlier. We need a photosensibilizer plus light, and that actually equals PDT. All right. And a few cases that we have when we apply the beam light of LED versus laser, and you can see how with the methylene blue on the left hand side of your screen, if you focus on the laser, you're going to see that it's very focused on a particular area. If you have a specific area, as the picture that David showed us for onychomycosis, then we're going to be very successful when we apply it. All right. So for its applications, it's an important adjunct in medical treatments. What we're looking for is also to stimulate the body to synthesize existing hormones and enzymes that were not synthesized due to the lack of stimulus, and that the main purpose is to reduce treatment costs, hospital stay time, and collateral effects due to, in many cases, prolonged use of medications. So no more medications for long periods of time. Doesn't mean that we are not going to use them, but we're going to use them less, which is good. So at this point, I like to stop real quick, or to make as little stop, because these are most of the questions that I get usually. So throughout this time, we heard a lot of times that laser produces radiation. So the question usually is, does it go through the body or cause cancer? In general, laser radiation is not in itself harmful. Okay, behaves much like an ordinary light in its interaction with the body. The laser radiation should not be confused with radio waves, such as microwaves, or, as I mentioned earlier, the ionizing X-rays or radiation from radioactive substances such as radium. Right? All of lasers are legal for consumer use. Actually, no. Some lasers, or most lasers, particularly as powerful as the Remy, are strictly for use by medical, industrial, or entertainment professionals. So just the correct people should use them, right? It shouldn't be used for anybody or with just anyone. Just because I have the money and I buy it, I wouldn't recommend to do that. You know, you have to have the proper training, which in our case we do, or Sacrament Technologies does all the time. We are always going to protect you and make sure that you have the correct knowledge and the qualified people in order for you to use or make the proper usage of the equipment. All right. So some more questions. Speaking of methylene blue, the cost, the price range may vary from anywhere from 5 to 15 US dollars. So as you can see, it's like very inexpensive. It lasts a lot. This 30 milliliters, the one that I have here on the left hand side, actually I have something similar to that, and it lasts me almost 3 years, and it doesn't decrease the power or the usage because it's actually dissolving water, so it's very easy to use. All right, but some of the other uses you probably heard of, or if you haven't, it's being used, or sometimes it's used also in cattle. So in many instances is used for that. So that's why we have an intravenous use as well. All right, how effective PDT is? Well, studies show that PDT can work as well as surgery or radiation therapy in treating certain kinds of cancers and pre-cancers. All right, it has some advantages such as no long-term side effects when used properly. That's why always stick to the protocols. Okay, and it's less invasive than surgery. This treatment, is it safe? It can be considered an effective and safe treatment for when we have the melanoma, skin cancer. Pain is the most clinical relevant short-term complication, but very little, almost close to 1 or 2 people out of 30 that I have treated in the past. And as I said, it reduces long-term patient satisfaction. So the cost of the PDT treatment, well, it's going to have a variety of costs. It depends where you are in the US, but in some cases, depending, the particular area that you're going to be using it for, but let's speak of onychomycosis, can cost anywhere between $100 and $400 per session. It's up to the professional that determine, depending on, as I said, the length of the treatment. Is it painful? In a single day procedure, is very effective. As I said, it's safe, is non-invasive, and it allows treatment of large areas, which is a very good thing to have. The only drawback is that in some instances, pain is experienced during its application, just during the process of the application. All right, but this goes then in related direction to the protocol. So if you follow the protocol, you shouldn't have any problems. The recovery time from photodynamic therapy, anywhere from 2 to 6 weeks, depending on the area, as I said, and then because of that, once it heals completely, it's going to depend on which part of the body has been treated. So I'm just giving a broad variety of what we can do with it because I have used it in for some muscular problems, but just the phototherapy part of it, not the photodynamic, right? But I mean, it's a combination of both. That's why I'm speaking of. Are there any side effects of photodynamic therapy? Well, sometimes swelling is going to be the most important ones. The discoloration of the skin because of the application of the methylene blue, but in many rare cases actually. And then blisters on the screen, itching, a little bit of burning once at the moment that you are applying it, not post the therapeutic effects that I can tell you. And in small cases, skin infections because the patient didn't follow the correct protocol or advice that you gave them. All right. And well, for PDT in podiatry, and let's call it onychomycosis then, we have to take in consideration when we talk about epidemiology, the patient's age. Genetics is a factor of control a lot. It's not the same type of response that you obtain, let's say, from a person that it lives in a small, tiny area in Peru than someone that lives in New York, for example. So it's different because the lifestyle is different, the type of food is different, and of course the care that you perform on your feet is going to be different. So the epidemiology on onychomycosis presents a pattern, a family pattern. And then, as I said, the family style has to do with it, sports, footwork, profession, okay, and diabetes as well. AIDS and peripheral arterial disease are predisposing factors. So do you recommend it? A lot of people ask me. It all depends. The age of the person, of the patient, as I said, because of the simple fact that, as you might know, or the people that has experience with onychomycosis, the person, if it goes past 65 years old and is a diabetic person, is going to have a different type of nail. The nail is dystrophic now, and so you have to take care of it. It doesn't mean that you don't have results. I have worked with people, diabetic, that have a dystrophic nail, that we fix them very well. We don't make like miraculous promises because no, you can do that. But I mean, what you can promise is that if you stick to a protocol and the person aid you to do the process, you're going to have results. Okay, not the super great results, but you do get a great deal of results. Okay, the prevalence, just for you to know, diseases that attack nails are the most frequent, and they represent more than 50% of all onychopathies. The systemic antifungals, such as itraconazole and terbinafine, as I said, they generally represent only 43% of the cure rate. So medicine works, yes, it does, but you know we are going to be having person with side effects, and then maybe a problem with if they have flu or any other side effects that you might have and you might find out when it comes to the systemic antifungal. So the most I can get my patients away from getting anything systemic, I'll do it. And I believe that's has given me very good results. So the photodynamic absorption, and we have an action mechanism. It goes by inactivation and light action plus an oxygen photosensitizer. It generates reactive energy and free radicals. And the reactive forms that we know of is the type 1 reaction and the type 2, and it goes related, all of them go related to how you apply it, and then the way that you oxygenate the cell. So remember, and I believe one of the very first times that I spoke with David, when we think of an onychomycosis, think of it and treat it as a lesion, because you're going to be more successful, as in just thinking of it as this thing that happened to me or happened to my neighbor or to my dad or to my uncle, and well, let's just put this cream on and see what happens. All right. No, so it's not just about applying a cream on it or giving somebody a pill. It goes a little bit more further down, and you have to really make a good observation and a good dynamic with the patient. So always take your time to make a good anamnesis and ask the person, the patient, the right questions. All right. So for fungi, once again, on yeast and dermatophytes for the treatment of skin mycosis, PDT, as I said, is cost effective. It's highly selective and avoids the occurrence of drug-resistant strains. Therefore, PDT might become available alternative to the already established antifungal drugs. When it comes to warts, and I was reviewing my presentation, I don't know what happened. A couple of the slides I skip them or something happened, but it's where it gives me the most results when it comes to warts. There is a protocol to follow, and as I said, here goes one of the laws that I told you about, the Bunsen and Roscoe's, because it goes directly to the application, the time that you're going to be applying, the power of or intensity of the laser, and then of course the result that you want to get. Usually in general for warts, it takes me when we have the mosaic ones, at least a few weeks, in 2 or 3 sessions per week in order for us to have the correct results. But I'll promise I get you that protocol, like the one step at a time, so you'll have it once you decide to speak a little bit more about the Remy and the usage of it once you, of course, get it. And then just to remember, at the cellular level, that's the step-by-step what we actually need to do, and just to simplify things. Once we have the excited state singlet, particularly with the photosensibilizer, then it's going to go into the intersystem, crossing the triplet, as I told you, to create a phosphorescence light to obtain the free radicals and then obtain the DNA damage and the cell death, or which is called the apoptosis. Think of this process, the ones that don't know it and the ones that do know it, just bear with me. What we do know from a normal cell is actually the formation of globin, and then what we need to do is make the cell to break apart into several apoptotic bodies, which are then phagocytosed, and this is going to avoid inflammation. And I just show there the necrosis so you'll know what's the difference between one of the other two. Think of the apoptosis as a program cell death. That's what we actually looking for at the very end of it. And so some of the expected results, this is one of my last patients during this pandemic year. We began, as you can see on the first slide at the top of it, he's a 36-year-old patient. First session was in April, and by June, that was the result. So he is pretty much out of it. And the little tiny blue marks that you can see there is because of the application of the methylene blue. How long does it stay there? Usually, in general, close to 2 weeks. I recommend my patients not to remove it, just let it be, and it'll go away eventually, and just keep applying or following the protocol that I give them to follow at home, and it gives results. So this is one of the other patients that I had, results in 3 months. It's a difference, and I'm gonna promise David that I'm gonna start using the drilling technique. But I usually, what I do is I debride, as you can see, the nail that has fungus, and then apply when needed and to the area that it needs to be applied, the methylene blue. And these are the results are 4 months. All right. And this is more or less what happens past 6 months. Some of the fungus have more resistance. I found out that most of the times people that urinates while they are taking a shower, it increases the power, if we can call it like that, the power of the onychomycosis. So just be careful with your patients and make sure that what are the things that they do at home. And I mean, you have discretion with your patient, but you can actually tell them, hey, don't do this because this might be the consequence. So what we do with phototherapy, or the dynamic of it, is to promote improvement of as I said, post-operative symptomatology. I'm not gonna stop strengthening this out. Accelerates the stages of healing by relieving pain, and what we're looking for is to reintegrate patients to their activities in less times. So in conclusion, PDT includes the systemic or topical administration of an oxygen and sensibilizer alongside the selective illumination of a target lesion, or in this case, the area where we have the onychomycosis, with light in the appropriate wavelength in order to cause localized oxidative photo damage, promoting then improvement of post-operative symptomatology, okay, relieving pain and reintegrating patients to their activities in less time. This is very interesting, and this is the, I cannot get tired to stress this out, because that's what pretty much many customers or many patients are looking for. Although in present, no clinical treatment based on PDT has been licensed. That is why PDT is an emerging area of interest in the discovery of novel antifungal therapeutic strategies. So listen, all I have to say is that not to believe my words, because words are words, and there is a saying in my country that words are words and words are taken by the wind and then they disappear. So believe in technology, believe in the theory of technology and the presentation and the protocol. What I showed you here is just a tiny fraction of what I've done for almost 10 years now, and it gives results. Believe me, it gives results. And as I said, always to my customers, or I'm sorry, to my patients, don't take my words for granted, but let's try to follow this procedure and stick to it, and you'll get results. And I have so far a great deal of people that are recommending me, and they are very happy. And my last words is like, in order for us, if you are really interested in a product like this, which is a very good product, and this type of procedure, which is called the photodynamic therapy, don't forget it, you have to use it. And then we, as a community of people using this technology, are going to be the ones that actually have then a precedent that that is going to be licensed at the end and recognized as a therapeutic option, right? There are many options, there are many ways to treat any type of disease. I'm not saying that we have to stay away from medicine, but this is an option that I believe is going to be, has to be contemplated in the future as a very strong option. However, then history, my last words are, history has proven time and time again that downturns are the best time to invest in new startups. And I didn't say that. That's actually Steve Jurvetson, which is the managing director and founder of Future Ventures. And the way to get started is to quit talking and begin doing. So let's do, or let's all get together to do, so we can show that we have results. And this is it for me. And thank you very much for your time.
Eddie, thank you extremely well. I consider myself one of your new students, and I have some questions that I think either doctors out have been thinking about. But the more I talk to you about this, this is not something you dabble in. You got to become an expert and learn, and always keep learning. And here's some of my questions, which answered some of them. That is, you've been doing photodynamic therapy for about 10 years?
Yes, sir.
Okay, and so you've probably done a lot of cases, and I'm going to be skipping around here. Is there a limitation? You know, we say we have mild. If you have that real thick fungal nail, which is still used which is still used photodynamic therapy, is there a limitation on the severity of the nail?
No, well, not really. But to be very honest with you, there have been instances where I had to do actually a complete removal of the nail to begin from zero ground. But that's like in a very particular case. It was not a very old person actually, but it was a diabetic, type 1 diabetic individual, and he had a severe case of on onychomycosis, which dystrophic nail. And so we did start with the regular pace of it. We actually debride the nail, and then past the third application, we decided to remove the nail and begin from there. And we had a pretty good result. The nail didn't come out as a baby's nail, but it had like a nice color and good consistency.
Do you ever do multiple nails?
Yeah, in most cases I do.
On the amount of nails?
Yeah, for some reason I mean, maybe somebody might have a different opinion, but for some reason, for me, I had the best results on the first toenail. For some reason, the other ones are the ones that, depending on the biomechanics of the person, I mean, whoever knows about this, the biomechanics plays a role, a very important role, in the type of shoe that you have. And of course, if you have a particular activity, and if you practice a sport, if you ride a bicycle, or if you climb to a mountain, depending on the type of shoe, you're going to have a different biomechanic and a different type of a pounding on the nail. So yeah, it depends on the nail, depends on the shoe. You're going to have a different type of onychomycosis. I would say that we can actually divide them within the same foot, depending on the toe. We're going to have a different type of case per nail. Yeah.
Now you mentioned something that I just picked up. I'm learning each time that you talked about with photodynamic therapy. We're going to talk about on a fungus toenail. If they come in with a painful nail, you're saying the treatment helps to reduce inflammation and pain. I understand it would do this, but I never thought about this before. The treatment itself, besides helping to oxidize the mycotic, the T rubrum cells, etc. It reduces the pain and inflammation?
Yes, it does. It actually does.
It makes sense.
Yeah, one of the key bases that I use, or that I have, is that, remember, the way that I have been doing it is a little bit different versus what you have, which is the drilling, which, as I said, I promise I'm going to start working on that particular.
Yeah. I got to get you some bits.
Yeah, but the thing is, when I remove the portion of the nail that has the most fungus, you do have to clean out as well the nail bed. And once you do that, there's going to be a little swelling or inflammation. But once you apply the methylene blue and the light, it helps reduces pain. It helps reducing pain a lot. Inflammation as well.
Yeah, that makes sense because as I was saying with the Remy, there's the surgical part and then there's the therapy part, which is geared to the inflammation.
If you use it right in a therapeutic level, yeah, it is going to help. Not just, I mean, just take that for the same thing that you would do with a muscle, and it's pretty much the same type of
Makes
situation.
sense. It's something I never thought about. What else did I? Now, what do you think about putting the little drill holes in, and then, well, I guess my question is, does methylene blue stain skin permanently?
No, no, no. It's. I mean, it is going to stay there for quite some time. But as I said, it's actually lipos. It's being absorbed, but not in a bad way, and then it disappears. People taking showers, pretty much like in a daily basis. I sometimes my therapy goes like per every 15 days, and by the time they come to the second or third session, we already have like pretty much no methylene blue. So sometimes I do have to reapply it again. So
Okay.
it goes away pretty fast. So
Okay.
if you
And
drill, it'll go better. I mean,
right.
it'll go down better. But just by itself, just the application of the methylene blue, it'll disperse pretty much very well within the nail bed.
Yeah, I could continue asking you questions all night, but I do want to tell everybody, and then we'll open this up. There are a few questions. If anybody has a question, Sarah will explain how to open up your mic. But whether it's about the Remy or the photodynamic therapy, but Eddie has been very kind to put together. It's like a 30-page manual. It's a long manual that when you purchase the Remy, you get it, and also people that have the Remy they're on tonight will get the manual. And Eddie is always here for consultations. I mean, he's in South America, and I talk to him like he's, in my same hometown. It's amazing the communications that how easy it is to communicate with someone. I really want to thank you, Eddie, tonight for your expertise and willingness to share your expertise. From one podiatrist, from a North American podiatrist to a South American podiatrist, I want to thank you. Sarah, can we open up any questions? I see one question there. I don't know which I can answer. But is anybody, how do you want to do this, Sarah? Do you want them to open up
Sure.
and talk?
Absolutely. So just so everyone is aware, you can continue to ask questions in the question field. You can just type those in, or what I'm going to do right now is I'm going to manually unmute everybody who is online, but please note that you are also self-muted. So as I unmute you, you will also have to unmute yourself because you are self-muted. And then if you have a question that you would like to voice just with your words in your mouth versus typing it in, you can do so. So I'm just going through. It looks like I have unmuted on my end everybody from an organizer standpoint. So
Right.
if you have a question that you would like to speak up with your voice, Dr. Walters, if you have a question, please feel free to hit your red microphone to turn it to green, and you can ask the question over the microphone, or you can type it in, totally up to you.
Sure.
It will get answered the same way.
Sarah, Dr. Zuckerman has one more question already. I'm thinking about this.
Well, Dr. Zuckerman is just manipulating all the questions.
Eddie,
I'm teasing.
can you overtreat a patient with methylene blue to where it can be harmful? I'm talking about in each session. I know you told me I'm giving a little bit of the math. It's about 40 seconds per session. Could you overtreat it by accidentally if you did 2-3 minutes? Would that inactivate it? What, in your experience, if anything, could happen?
Well, yes, it could happen. The thing is, the way that I do it is per nail, or depending on, as I said, that depends on the area of the nail that you're going to treat. But let's speak of the first toenail. If you work on that one, I usually do 3 repetitions within the same session of anywhere from 30 to even 60 seconds each. It depends. I might say that you should gradually perform the application of it, the pH of every person is different, and the only thing that people might reflect are a little bit of pain. Burn, no, I haven't really have any cases of it. I heard of people that did overdid the application of methylene blue. So listen, do not overuse anything. I mean, it's like if you overuse any product, any medicine, then you're gonna have consequence. So just stick to the protocols. Every laser is different, and people really should get a good knowledge on the Remy, for example, in order for you to be a very Remy savvy. So you're gonna be on the safe side.
I keep thinking of more questions. Is there a clinical appearance, or is it that you see that you say, I've accomplished the treatment, or is it just timing?
No, yeah, you can actually tell. You see, gradually, and the beauty of the methylene blue that I keep saying to the people, even to my patients, is that once you keep progressing, I stop applying the methylene blue to the entire nail surface. Why? Because I want people to be able to see the results. So
Right.
yes, you will. You will see. There is a tiny difference or line that is going to be drawn. For some reason, it happens, but it goes in contrast of the pH, and you're gonna have like a wide line, and it's going to show on the nail. And it's when
So,
when you show there's when you know that you have a result, a positive result, because let's say like from the north area of the nail up, you're going to see the ugly nail, and then the south part of the area of the nail is going to be white, nice, with a
yeah,
very good consistency.
yeah, I understand what you're saying. You're talking about the overall improvement and reduction of the disease now, but I'm talking about the first treatment. Do you go by the timing, or are you seeing, for example, when you treat a wart and you're with the Remy, you can see a purpura, and that shows that the laser energy is going into the capillary bed. Can you
Right, right.
do you see anything on that nail as you're treating it that will indicate that you've accomplished your first treatment? Does that make
Yeah,
sense?
yeah.
What
Yeah, because you see the protocol that I follow, and then I will have to talk a little bit more in depth of the protocol, of my protocol. But you do have to debride a little bit of the nail, prepare the nail, and then apply the methylene blue. And so once you are at that stage, you will see a difference on the nail. The people tell you, hey, I can see now, and you haven't even applied the light, and I can see a difference on my nail. So yeah, once you
But the
progress.
methylene blue doesn't change a different color or anything like that? When there's interaction, can you see an do you see oxidation going on? Is when you laser that and you put the energy into the methylene blue, are you seeing a difference in the methylene blue color?
Yes, sir. Yeah, it does changes, and it goes like from blue to kind of like a little bit brownish color.
Is that your
So
endpoint? Is that your endpoint of treatment?
yeah,
Okay.
it
So
is.
anyway, we could talk about this for hours. I do want to bring you back at a later time to just talk about the treatment of verruca and skin fungus. We're going to talk about that. I mean, this is not something. It's a separate, you know, um, expertise that you have to learn, and that's what I always say with lasers or anything. The more you delve into this and learn this and practice this, and it's very easy to become average. You gotta take this serious and be involved in it. And that's why Eddie is going to be, again, anybody that does photodynamic therapy and purchases the Remy and will get Eddie's expertise and his manual. What's about 30 pages, this manual you wrote? I couldn't believe it.
Yeah, pretty much. So yeah, as one thing that I want to keep, just my final words, if I might. We are never gonna leave you alone. Me as part of the team, as in Soccerman Technologies, I want you to know, whoever is listening to us right now, whatever question, whatever comments, whatever anything that you may need, we are available, and that's why I took the time to actually do the best manual possible, including all of the expertise that I have. And I have a separate area where we talk about verrucas, and a separate area where we talk about
I was
the.
shocked.
So
I was
we
amazed.
back. We have you back.
Does anybody have any questions that wants to discuss anything with Eddie or about the Remy? And then I'll answer. There's one question I can see that I'll answer, but I don't want to, be a pig and dominate this because I get excited over technology, and this has tremendous potential. Any questions at all? Anybody want to open their mic up? Anything like that at all? I don't want to hold you too much. I'll give it a few seconds and I'll answer the one question that I can see here. I'll give it a few seconds. Anybody have a question at all? You can also email Eddie personally. I'll make sure you get his email if you reach out to me. But there was one question which is interesting is what's the difference between the Remy and the K-Laser Cube? I'm not sure which the cube it is, but the Remy was actually developed on the from when I sold the K-Laser 1200, which was one of the first modern lasers that K-Laser many years ago. I was a distributor and I sold the laser, but I'm always improving. First of all, the Remy's 30 watts, the cube's only 15. The K-Laser is only cleared for pain and not surgery for warts and not onychomycosis. You get a lot more. I like a multi-function portable laser that you can carry around and you can program almost anything, almost any protocol. Again, it goes from 0.1 to 30 watts and you can change the frequency. So on that note, if anybody wants the comparison, you can, Dr. Rainier, you can email me. I have a direct comparison. There's a lot more. I just want to give a broad overview. But again, I want to thank everybody for coming out. I know it's getting late. We've been actually talking for over an hour and 15 minutes. Eddie, I want to thank you. We'll be talking again soon. And I want to wish everybody a great night, what's left of it. Thank you very, very much.
Fantastic. Thanks, everyone. Have a good night, and we'll see you again soon.
Thank you.
Bye-bye.